Please click the like and subscribe buttons so that you can receive more of MAP's clinical pearls and technique videos.
G'day, Chris Showalter, Program Director for MAPS. Prior video we talked about the value, or Brian talked about the value of medial rotation of the knee itself. It's important that we're able to differentiate the rotations that are occurring in the knee and the hip. So in this position here, this is a fairly standard position to put a patient in, a little bit of towel underneath the knee, take it into about 5 to 10 degrees of flexion. To check and differentiate medial rotation knee from medial rotation hip, we're going to start by stabilizing the distal femur and medially rotating the knee itself, the tibiofemoral joint. And that's evidenced by the movement. Can you see those toes? That's evidenced by the movement of the toes. And it's a little bit of movement, but it's important movement, as Brian stated. The other rotation we want to take a look at is whole leg rotation, which is occurring through the hip. And if you look again at the toes, you can see how much those toes are moving with this rotation. The patient population who absolutely adore this technique is your older OA hips, okay? This is one of the movements that's commonly restricted in these patients, and you'll often find R1 fairly early, and then R2 comes on very soon afterwards. My patient Michael's young and doesn't have OA, so he has lovely medial rotation of the hip. So these patients with OA of the hip will respond quite nicely to a medial rotation of the hip. Note my position from my body. Take a look at where my movement's coming from. It's not my hands, it's not my wrists, it's not my elbows, it's not my shoulders, it's my body that's moving this body part. Hope this helps.
To learn more about MAP's 17 different remote learning and live course options, go to ozpt.com.